Thank you very much, Mayor. So we are 12 weeks into our vaccination campaign in the United States and here in Chicago. 12 weeks and 1 day ago is when the first vaccine was administered at the Loretto Hospital here in Chicago. And in 12 weeks, more than 110 million COVID vaccinations have already been given across the United States. Here in Chicago, we'll cross the 1 million mark in about a week. And the data couldn't be better when we look at how these vaccines have performed from a safety standpoint, from an efficacy standpoint. The fact that we can be standing here in March already talking about an expansion that will make most Chicagoans, many Chicagoans, eligible for COVID vaccine is really a tribute to scientists around the world and around this country that worked to bring a vaccine, a safe vaccine, in record time. Approximately 1 in 5 Chicago residents has now gotten at least a first dose of vaccine. If you limit it to adults, we're at nearly 1 in 4 Chicago residents has gotten at least a first dose. And where we look at Chicagoans over the age of 65, we're at nearly 1 in 2, about half. And although that is great progress, particularly as you heard the mayor say, folks over 65, we're not done yet. And our priority before we move into 1C on March 29th is to keep getting our seniors vaccinated. So let's take a quick look back. For approximately the first 6 weeks of vaccination, from late December into January, we were in phase 1A, focused on healthcare workers and long-term care residents. Chicago was getting less than 5,000 COVID vaccine first doses every day to stretch across the entire city. As vaccine confidence has grown and vaccine supply has grown, everyone who is eligible in 1A has now had repeated opportunities. And we estimate that approximately 70 to 75% of the people who are eligible in 1A have now gotten at least a first dose of vaccine. In late January, we opened up to phase 1B, which means that in February and in March, we've been focused on vaccinating people 65 and older and frontline essential workers, with a particular focus on getting vaccine into the hardest hit settings and communities. We've also continued to vaccinate the people who became eligible in 1A, and we have successfully made second doses available on time to every Chicago resident who has gotten a first dose of vaccine. We have continued to use every dose of vaccine that we have received with no vaccine going to waste. We've hit every benchmark on efficiency, putting more than 95% of our vaccine into arms within 7 days of receipt. And importantly, vaccine supply has continued to increase so that besides what the city is directly receiving, which is up to between 9,000 and 10,000 first doses per day now, there are also direct federal allocations that are coming to pharmacies and to sites like the United Center. And so we're now getting more than twice as much vaccine as we were getting in phase 1A. It's still not enough to meet demand, but it is a major improvement. And that means by the end of March, we will have been able to offer vaccinations to enough of the 1B group to, as the mayor said, move to vaccination phase 1C on March 29th. This marks a major increase in eligibility, and that means that in April and May, we will be focused on vaccinating people with underlying conditions and essential workers, especially those who can't work from home. But we're going to keep our focus on anybody who didn't get the vaccine yet in 1A or 1B and continue to make sure that where people are getting a 2-dose vaccine series, they get that on time. 1C will include Chicagoans with underlying conditions that put them at increased risk for severe COVID outcomes. It also includes other essential workers with a focus on those who can't work from home. So as you heard, that includes warehouse and delivery workers, restaurant and hotel workers, people who cut hair and do nails, construction, retail workers, and people who work in shelter and housing. We'll be providing a detailed list, both of underlying conditions and of the essential jobs on chi.gov/COVIDVax. And I want to emphasize that between those with underlying conditions and essential workers and everybody in 1A and 1B, most Chicagoans will actually be eligible to be vaccinated beginning March 29. But just because you're eligible, it doesn't mean you're going to be able to be vaccinated right away. It's all going to depend on vaccine supply. We do not have a large amount of vaccine to release onto ZocDoc on March 29th because we have no vaccine sitting on shelves. And while you should continue to check ZocDoc.com for appointment availability, please know that this supply is going to ramp up over the next couple of months. Just like when we moved into 1A, we didn't have enough vaccine for everybody at the beginning. Just like when we moved into 1B, we didn't have enough vaccine for everybody at the beginning. But as we get further into the phases, vaccine supply has opened up, and I'm confident, based on everything we're hearing from the federal government, that the same thing will happen. So if you are in 1C and you're anxious to be vaccinated, assuming the federal protections hold, we do expect you'll be able to make a vaccine appointment in April or May. April or May. It's likely to be May before we have enough vaccine to be able to partner in large ways with employers at a significant scale. And to be clear, we're not going to be done vaccinating Chicago in May. We'll definitely still be vaccinating hundreds of thousands of Chicagoans through the summer and beyond, but this is going to start feeling more like a traditional flu vaccine campaign, where the problem is not finding a vaccine, it's having the confidence in making the decision to get a vaccine. And we will continue this focus on seniors, especially between now and when we move into 1C. If you know any Chicago resident who is 65 or older who has not been vaccinated, you can also please help them call 312-746-4835. We have more than 200 contact tracers standing by. They're not as busy right now because our COVID cases are under good control. So some of them are working at the pods, and 200 of them are taking appointments, and they've booked more than 17,000 appointments by phone just in the last few days, many for seniors. I want to thank those folks, and again, please, we want to get our seniors as heavily vaccinated as we can. Our focus in Protect Chicago on prioritizing vaccines to the settings where COVID has hit hardest has paid off, as we brought vaccine to long-term care facilities and homeless shelters and senior independent living facilities, which we will have brought strike teams, mobile vaccinations, to every independent senior living facility by the end of March. We've already prioritized vaccine for our first responders, CTA employees, grocery store employees, child care workers, manufacturing settings, or more. And then obviously through Protect Chicago Plus, we've gotten vaccine to the communities hit hardest by COVID. And so over these last 12 weeks, the good news has not just been about vaccination numbers coming up. It's been about this drop in COVID cases, this drop in COVID positivity. And although a lot of that is because thank you to every one of you who has continued, and we need you to continue to do the things that protect us all. It also is because we've managed to get vaccine to the settings that are most driving our outbreak. And over the last month, I'm thrilled to say not only are our numbers lower, we've essentially erased the racial and ethnic inequities in COVID case rates and deaths that have plagued COVID since the beginning. Getting vaccine first to the highest risk settings has the biggest impact in driving down case rates. It helps protect every one of us from the emergence of variants, and it moves us closer to reopening and getting back to normal. And so the last thing, as we look ahead beyond that, we had previously projected being able to move to phase 2, which means all adults, at the end of May, with a focus on getting those folks vaccinated in June and July. I was honestly surprised to hear President Biden call for eligibility for all adults by May 1, since the vaccine supply we've received to date in Chicago would not necessarily support that timeline. But I'm taking it as a sign that the federal government is confident that vaccine supply will ramp up even faster over the spring. And as vaccine supply ramps up, we are more than ready here in Chicago to get it into arms. We have nearly 600 healthcare providers registered, trained, ready, and anxious to vaccinate their patients, most of whom haven't been able to start vaccinating yet because we haven't had supply. We have plans for scaling up more mass vaccination sites. We've just been waiting for vaccine. And we'll keep a continued focus on reaching vulnerable Chicagoans, like those who are homebound or less connected to medical care. Just as we've done every day for more than a year, We will be looking at our data every single day. We'll be adjusting operations where we need to ensure this vaccine reaches across Chicago and gets us past COVID. I want to clarify that beginning March 29th, only Chicago residents will be able to be vaccinated at City of Chicago vaccination sites. We've asked healthcare providers to continue prioritizing vaccination for their existing patients who have the most underlying conditions, so we don't require residency requirements for you to get vaccinated with your regular doctor. When we are doing employer-focused vaccinations, which is likely to be able to begin probably more in earnest in May, we also will not ever require a residency requirement if we're at a site vaccinating. But for public City of Chicago vaccination sites, like those that will be available on ZocDoc, at least for the next couple of months, we will be limiting that eligibility for Chicago residents. So keep checking with your healthcare provider, keep checking ZocDoc. Again, more vaccine is coming. April or May is going to be your opportunity to get vaccinated in phase 1C in Chicago. And with that, I'll bring up Dr. Luna, who's going to give some remarks in Spanish. Thank you.